Welcome back guys. Now let's begin with the WBC disorders. Now in this video, I will be mainly concentrating on the basics. In this video, let's discuss about what exactly is leukocytosis and leukopenia. Okay. So in order to understand what exactly is leukocytosis and leukopenia, first of all, you should know the basic flowchart for the leukopoiesis, the how WBC are coming from the stem cell. Now you know there is some stem cell, hematopoietic stem cell, which is present in the bone marrow, and that's the one stem cell which is going to give rise to multiple types of blood cells, right? So now let's begin with the hematopoietic stem cell. Okay, this is our hematopoietic stem cell. So how to recognize hematopoietic stem cells? In bone marrow there are many cells are there. So how to pinpoint? So this is the hematopoietic stem cell. See, on this hematopoietic stem cells, there is a marker which is called as CD34. So hematopoietic stem cells are CD34 positive. Now we know it. It's a stem cell. As it is a stem cell, it is going to divide and forms multiple newer type of cells, and they also maintain their own progeny. So stem cells always, when they divide, they maintain their own cell population, not progeny, sorry, they maintain their own cell population. Of course, they will give rise to the daughter cells, but also they divide and maintains their own cell population. Okay, so this hematopoietic stem cell, yes, it divides and it forms some myeloid stem cells. When it divides, it can form myeloid stem cell. It can also form lymphoid stem cell. Okay. Now my question to you. So what exactly is myeloid stem cell and what exactly is lymphoid stem cell? See, the myeloid stem cells, they will divide and forms all the blood cells. All different types of blood cells are going to come from the myeloid stem cells. Okay, RBC, WBC, platelet, all will come from myeloid stem cells except lymphocytes. From the lymphoid stem cells, it's the lymphocytes. Which lymphocytes are? B lymphocytes and T lymphocytes. So lymphocytes will be coming from the lymphoid stem cell, but all the other blood cells will be coming from the myeloid stem cell. Now look here. See, this myeloid stem cell, it's going to divide and forms erythroblast. It forms erythroblast and forms myeloblast. See, wherever you see the word blast, blast means immature cells. Okay, they are the precursor cells, not the mature cells. Blast means immature cells. Next, monoblast. And last one is megakaryoblast. Okay, last one is megakaryoblast. Okay, now you know it, in the name itself is there, erythroblast. Erythro means erythrocytes. From the erythroblast, after multiple divisions, even the erythroblast, they are also like the stem cells, they will also divide and forms the mature cells. Okay, so erythroblast will give rise to mature cells called as the RBCs or erythrocytes. This myeloblast, in the future, they are going to form neutrophils, basophils, eosinophils. Next, monoblast will give rise to monocytes. After entering into the tissue, these monocytes are the one which becomes the macrophages, you know it. Next, megakaryoblast are the ones which are going to form megakaryocytes, which are nothing but the platelets, the mature cells. Megakaryoblast are going to form the megakaryocytes, which are nothing but platelets. Okay. Now, let's talk about the lymphoid stem cell. Now, this lymphoid stem cell, it will also divide and forms precursor cells, that is B lymphoblast and T lymphoblast. Now, it's very easy for you. Now, tell me, this B lymphoblast, these are the immature cells. Now, they forms B lymphoblasts are going to form the naive B cells. Naive B cells. Okay, naive B cells which are not yet educated, they don't know, like they don't have proper education. The education will be happening in the spleen, in the thymus, you know it. Okay, the naive B cells, they will go into the spleen, they will go into the bone marrow, they will go into the thymus where they get educated, like how to produce antibodies, how to recognize the antigens, what is self and what is non-self, what is foreign. So these are naive B cells. In the future, they forms the B cells, activated B cells, and the activated B cells later when they can be converted into plasma cells. The B cells can be converted into plasma cells, and the plasma cells are the one which produces the antibodies. Okay, plasma cells, you know that cartwheel shaped nucleus. Okay, the wheel shaped nucleus will be there in the plasma cells. They are the ones which produces the antibodies. Cool. Next, what about the T lymphoblast? See, T lymphoblasts are going to form the naive T cells. The naive T cells in the future, they are going to form two different types. That is CD8 positive, which will be mainly seen in the viral infection, CD8 positive T lymphocytes, as well as CD4 positive. Okay, CD4 positive T lymphocytes. There are two types of lymphocytes. Okay, there are two types of lymphocytes, CD8 positive lymphocytes and CD4 positive lymphocytes. Both are coming from naive T cells. So they are coming from the T lymphoblast. So this is the lineage. This is the flow chart in which you can see all the cells, all the blood cells are coming from one single hematopoietic stem cell. Okay, all the blood cells are coming from one single hematopoietic stem cell. Now, having discussed about this, like this flow chart is going to be very much helpful for you when we discuss about the acute leukemias and chronic leukemias. There you will understand what is the importance of this flow chart, where I will be discussing the acute leukemias are mainly problem with the blasts. Okay, acute leukemias means the main problem with the blast cells. Okay, the immature cells. Okay, and chronic leukemias are the problem with the mature cells. If there is problem with the mature cells, then it is chronic leukemias. If there is problem with the blast cells, if the blast cells are dividing malignantly, they are proliferating, then it is called as acute. If mature cells are dividing, and if you see more number of mature cells in the blood, then it is chronic leukemia. That we will discuss anyway in the next video. Now in this video, let's stick to the basics. So this video is all about the leukocytosis as well as the leukopenia. Now let's begin with the leukocytosis, or let's begin with the, now let's discuss about leukopenia. So what exactly is leukopenia? Normally the WBC count, okay, WBC count will be somewhere around 5 to 10,000, okay, 5 to 10,000 cells per microliter. Okay, so per microliter you have this much amount of WBC, that's something normal. If you have less than 5,000 cells per microliter, okay, in 1 microliter, if you have less than 5,000 cells, then it is called as a leukopenia. Now question is, what are the causes of leukopenia? Why leukopenia, sir? Why the WBC count is going down within the blood? What might be the reason? The reason number one, every student knows that if the WBC count is increasing, if more number of WBC are there, means it indicates that there is some kind of infection going on in the body. Every student knows that. Every medical student knows that. Leukopenia, why? Why the WBC count is going down? It is because one reason might be drug toxicity. So what does I mean by drug toxicity? For example, a patient is on certain drugs. Okay, the patient is taking certain drugs, especially chemotherapy. He is on chemotherapy. Okay, he is on chemotherapy. So he is taking what kind of drugs? Anti-cancer drugs. So these anti-cancer drugs, you know it. The anti-cancer drugs are going to target those cells which are highly proliferating. Okay, those cells which are highly proliferating, the anti-cancer drugs are going to target those cells. Okay, so if a patient is taking chemotherapy or some anti-cancer drugs, in this person the WBC count will go down. Okay, that's the reason number one. Second reason is infections, severe infections. Severe infections. Now, why in severe infections? See, normally whenever there is an acute infection, yes, of course, WBC count increases. If it's a bacterial infection, neutrophil count increases. If it's a viral infection, lymphocyte count increases. But if there is a severe infection, chronic infection for long periods of time, in severe infection, most of the WBC, now they have moved into the tissues. Okay, see, if there is a severe infection, most of, for example, if there is severe infection in the lungs, most of the WBC, in order to contain the infection, most of them are going to the lungs. So, WBC count in the blood decreases. So, in severe infection, yes, there is a possibility that the WBCs can go down, there can be leukopenia. Now, let's discuss about a special type of leukopenia. See, that is lymphopenia. Especially, who is going down? It's the lymphocytes. It's the lymphocytes are going down. Why the lymphocytes are going down? Okay, so the causes for the lymphopenia are certain genetic conditions like Dyejar's syndrome, so what exactly is Dyejar's syndrome? You know it. It's 22q 11.2 deletion. It's a deletion of chromosome 22q 11.2. This locus, the genes which are present in this locus are totally deleted. Now, whenever these genes are deleted, the third and fourth pharyngeal pouches, third and fourth pharyngeal pouch, are not developed. The third and fourth pharyngeal pouches are not developed. As the third and fourth pharyngeal pouches are not developed, in this fellow, the two important points which I want to know, in Dyejar's syndrome, they do not have thymus. Thymus is not developed. There is aplasia. Okay, thymic aplasia. Okay, so thymic aplasia, thymus is not developed, as well as the parathyroid glands. The parathyroid glands are not going to be developed. See, forget about the parathyroid here, because we are not concerned about the parathyroid. If the parathyroid is not there, like parathyroid hormone is not going to be produced, so these patients are going to have severe hypocalcemia. That's a total different thing. Okay, these patients will suffer with hypocalcemia, less amount of calcium, because the parathyroid hormone is not going to be there because of parathyroid aplasia. Now here in this, what I want you to know is, we all know that the thymus is a place where thymus is a site where the lymphocytes will mature. Okay, the maturation of lymphocytes will occur. Okay, so in Dyejar's syndrome, the patient is going to have lymphopenia because thymus is not present. Thymic aplasia, this patient is going to have severe immunodeficiency. Okay, severe immunodeficiency, these patients are going to have recurrent infections. Okay, so that's the point which I want you to know. So what are the other reasons? The first reason for the lymphopenia is certain conditions like Dyejar's syndrome or severe immunodeficiency conditions. Reason number one. The reason number two can be Cushing syndrome. Cushing syndrome. So what is the problem in the Cushing syndrome? You know it. Sir, in Cushing syndrome, which hormone levels are going to be elevated? It's the cortisol. So cortisol level will be elevated. We all know cortisol is a stress hormone. Cortisol is a immunosuppressant. Okay, cortisol immunosuppressant. So this cortisol, the high levels of cortisol is going to cause apoptosis of lymphocytes. Okay, the lymphocytes are going to be killed. Okay, apoptosis. So cortisol decreases the lymphocytes. Okay, that's the point which I want you to know. So Cushing syndrome. Next, any other condition? Immunodeficiency I have explained you, high cortisol levels I have explained you, and third reason may be autoimmune destruction. Autoimmune destruction. So autoimmune destruction means the patient is producing the antibodies and these antibodies are attacking the lymphocytes. For example, it is seen in conditions like SLE, systemic lupus erythematosus. You all know in this SLE, the patient is going to produce the antibodies which are going to attack the own blood cells. Antibodies will come and attack the own blood cells. So in this condition like SLE, there will be autoimmune destruction of the lymphocytes. So lymphopenia can be seen, possible. Next, radiation. Okay, the patient is taking radiation for some cancer treatment, radiotherapy. Now, remember, the most sensitive cell in the body for the radiation is lymphocytes. Lymphocytes are the more sensitive cells. They are more sensitive for the radiation. So whenever there is such high beam of energy that's coming, lymphocytes will undergo mutation and they will undergo apoptosis. Okay, so they are radiation sensitive cells. So there will be lymphopenia. Post radiation, there will be lymphopenia. Okay, if you want to know whether the patient is having high exposure of radiation, you can just check for the lymphocyte levels. Yes, if the patient is exposed to high amount of radiation, definitely the lymphocyte levels are going to go down in this patient. So with this, what we have discussed, we have completed leukopenia. What exactly is leukopenia? Less number of WBC. One special type of leukopenia that I have discussed here is the lymphopenia, which is usually seen in the immunodeficiency conditions like HIV or digestive syndrome, Cushing syndrome. High levels of cortisol, remember, high levels of cortisol is stress hormone, is going to decrease the lymphocytes. It's not only going to decrease the lymphocytes, but also all the WBC. All WBC levels will go down in Cushing syndrome except neutrophils. Okay, that's the one exception which I will discuss in the topic of leukocytosis. When we are discussing about leukocytosis, then I will discuss. Remember, cortisol, stress hormone, it's a immunosuppressant. It decreases all the WBC except neutrophils. Okay, neutrophil count will be elevated. Okay, so now let's discuss about leukocytosis. Leukocytosis. Now, what exactly do we mean by leukocytosis? More number of WBC. How much more, sir? More than 10,000. Okay, more than 10,000 WBCs per microliter. If you have this much amount of WBC, we can say yes, it's a leukocytosis. Now, here leukocytosis, see, if I am saying I have more WBC, which type of WBC? There are different types of WBC, neutrophils, eosinophils, basophils, okay, there are different types of WBC, right? Lymphocytes are there. Now, leukocytosis is because of which cell? It can be because of any cell. For example, first subtype I am discussing, there can be neutrophilic leukocytosis, neutrophilic, which means the more number of neutrophils are there, neutrophilic leukocytosis. What might be the reason for neutrophilic leukocytosis? First, already I have discussed with you, the reason number one can be Cushing syndrome. Okay, Cushing syndrome. That is increased cortisol. Okay, increased cortisol. See, cortisol, it decreases all the WBC except the neutrophils. Actually, in my body, most of the neutrophils, okay, so some amount of neutrophils are just circulating, okay, they are circulating neutrophils, but most of the neutrophils are in the tissues, okay. For example, most of the WBC, especially the neutrophils, they are in the pulmonary vasculature. Most of the neutrophils, okay, most of the neutrophils are in pulmonary vasculature. So these neutrophils are called as marginating pool. Okay, marginating pool of neutrophils. They are simply staying over there. Okay, they are simply attached to the pulmonary vasculature and they are just hanging over there. Okay. Now this cortisol, what they will do is cortisol will move this marginating pool into the circulating pool. Okay, so the marginating pool of neutrophils which are just staying in the pulmonary vasculature, which are just staying over there. Okay, they are just attached over there. So cortisol is going to move this marginating pool into the circulatory pool. So there can be neutrophilic leukocytosis, which means the leukocytosis is because of the neutrophils. One reason. And the second reason, you know it, the most common one, bacterial infections. Okay, infections, especially with bacteria. Okay, bacterial infections, because for example, if there is a viral infection, there will be more lymphocytes. Okay, even in fungal infections, there will be more lymphocytes, especially neutrophilic leukocytosis is seen with the bacterial infections. Okay, second thing is inflammation. Okay, so there is necrosis and in inflammatory conditions, acute inflammation. Okay, in acute inflammation, already in the inflammation topic we have discussed, in acute inflammation, the predominant cell that's going to be raised in the blood is a neutrophil, simple. Okay, so whenever there is a necrosis, you know, inflammation will start. Whenever there is an inflammation, you know it. Okay, so more number of neutrophils can be seen. So these are the causes of neutrophilic leukocytosis. The one important point for your exam which I want you to know is the cortisol increases the neutrophils but decreases all other WBC. Now, let's discuss some other type of leukocytosis. Neutrophilic leukocytosis is okay, completed. Now let's discuss about monocytosis. which means the monocytes in the body are increasing. Now, in which conditions monocyte levels are going to be elevated? Monocytosis is going to be seen in autoimmune conditions. Okay, in autoimmune conditions and especially in cancers. Autoimmune conditions and malignancy. If the patient is having any autoimmune condition, chronic, okay, long-term autoimmune conditions and malignancy, there can be monocytosis. Now let's discuss about eosinophilia. So what exactly is eosinophilia? In the name itself, it's there. Eosino means eosinophils. Okay, eosinophilia means loving, more number of eosinophils. So eosinophilia, it is seen in which conditions? Especially allergies. In allergic conditions or parasitic infections. Okay. So in these conditions, the eosinophilia is going to be seen in allergic reactions as well as the parasitic infections. The eosinophilia is going to be seen also in Hodgkin's lymphoma. Okay, in Hodgkin's lymphoma, yes, there can be eosinophilia. Now let's discuss about the basophilia, which means the basophil levels are going to be elevated. Basophilia. Now the circulating basophils, okay, the circulating basophil count is going to be increased in a condition, in a cancerous condition. It's a cancer of WBC, which is called as a chronic myeloid leukemia. We'll discuss about this. So in chronic myeloid leukemia, which is simply called as a CML, in this condition called as a CML, there will be basophilia. Now let's discuss about lymphocytic leukocytosis. Okay. So in which conditions you will see the lymphocytic leukocytosis? Say lymphocyte count is going to be especially increased in viral infections. Okay, so T lymphocytes, especially which lymphocytes? T lymphocytes. Okay, T lymphocytes. Especially which T lymphocytes? CD8 positive T lymphocytes. T cytotoxic cells, not the T helper cells. T cytotoxic cells, that is the CD8 positive T lymphocytes, are going to be especially increased in number in the viral infections. Next, see, usually this is something normal, whatever I have explained. Okay, viral infections, T lymphocytes are going to be elevated. Okay, lymphocytic leukocytosis. But in one bacterial infection, there is a bacterial infection in which the lymphocytes will go up. So what is that bacterial infection? It is Bordetella. Okay, Bordetella pertussis. Okay, so Bordetella pertussis is a bacteria. Okay, it's a bacteria, but it increases the number of lymphocytes. Okay, so this is the one exception which I want you to know. So completed. I have explained you about the neutrophilic leukocytosis. In the leukocytosis topic, I have explained you about the neutrophilic leukocytosis. Next, monocytosis, which is seen in the autoimmune conditions as well as the malignancy. Eosinophilia, which is seen with allergic infections, parasitic infestations, as well as the Hodgkin's lymphoma. Basophilia is going to be seen one condition, that's the CML, chronic myelogenous leukemia. And lymphocytic leukocytosis is going to be seen with the viral infections, and one bacterial infection which can cause a lymphocytic leukocytosis is Bordetella pertussis. Okay guys, we have completed the topic of leukocytosis as well as leukopenia. Hope the video is helpful. In the next video, we will be discussing about the acute leukemias. Thank you.